Okay, welcome back, everyone. Hi, yours truly, Debra Spears, back. I am the holistic health, personal health coach. I do all of the one-on-one coaching with people who are trying to get healthier, fit, lose weight, control your blood pressure, your cholesterol, whatever it is. The healthy coach, that's me. But today I want to share with you a little information on your health and as it relates to your finances. Or another spin could be your finances and how they relate to your health. That's the subject for today. Hang with me because you're going to see how the connection is going to help you with your health, your overall health. Whether you're shopping in the grocery store or trying to budget your expenses or trying to figure out what you should be eating now that may be more cost effective for you later on. And I'll tell you what that means in a minute. Cost effective later on, saving you money later on for what you're spending on the food products you buy today. So let's get started. I'm going to just cover the three basics, which is how your income, your money that you spend has now affects the cost of your health down the road, and how what you consume right now affects your health right now, as well as your health down the road. And the third thing is the politics of how that all relates to our government. First, let's talk about the things that you buy in the grocery store that are healthy for you, but may not be on the surface look like it's cost effective for you to buy because it costs a little more. So today you're spending less money in the grocery store on a product that is filling to you, it's tasty to you, and you don't see any harm. You don't feel any harm. There's no negative effects. Actually, it feels pretty good. So that's a category that you're consuming right now. And whatever your age group is, doesn't matter. Let's say you're in your 20s, your 30s, your 40s, whatever that age group is. Let's just 50s, 60s, 70s, okay, all of us. So you're buying the things in the grocery store that meet what you think meets your budget right now. It may not have a lot of fresh produce because you think they cost too much, or you think they spoil before you eat them all. They only spoil if you don't eat them. They only spoil if you don't eat them. If you eat them when you buy them, they won't spoil. And if you compare the price of produce in the supermarket to what you buy in a fast food restaurant or in a dining out restaurant that serves unhealthy foods that are packed with sugar and salt, you'll see that your expenses, you aren't really saving as much as you think you are. So to start with, my suggestion is to keep a diary on food and what you consume. I know it's another task to do. And I always tell people, well, come on, this process of being healthy and working our way through the system of how they have everything set up that's not really in our best interest for our health, it is not an easy thing to do. It is designed to be difficult. It was designed for it to be easier for you to go after the things that are not healthy and consume them and start to love them and not pay attention to what you're putting in your body. So if we keep a journal and we write down the things that we consume just try doing it for a week. Just write down the things you consume for a week. Everything. Just make a note. How much of it, what it is. And if you do really well, you can include what the content is, like how many calories it is. Is it something that's high in sugar? Does it have 16, 18, 22 grams of sugar in it in one serving? That's way more than you're supposed to consume in a day. Okay, so we'll write all those things down and keep track of them. And then go back at the end of the next week and look at it and see. Compare that to if you were eating fresh produce every day, something with fiber in it every day. Would you really have spent that much more money in the grocery store and bought some fresh fruit versus whatever the French fries or whatever you had at the fast food restaurant? because they're not cheap anymore, any longer. So that's the first category of focusing on what you're doing right now. Then I want you to make the connection with what you're doing right now to your future health and the cost of your future health. Not just how you feel, but the expense. Because right now, while you're healthy, in this category where you may not be seeing things, so we're all at different stages. But let's just assume we're working with someone who's right now not experiencing any medical problems, where you're regularly in the doctor being treated for this and this and this. Let's just assume that, okay? Then once you do that, and you're consuming foods that are not healthy over time, now fast forward and just visualize yourself 10 years from now, where you are. Now you have to see the doctor every 3 months. Now you need new prescriptions. Now this specialist, your copayment is higher, your insurance premiums are going up, and the expense of those visits. Let's think about it for a minute. Every time you go into the office, you have to pay something. The expense of those visits, every time you go in for a procedure, you pay something. Nothing is going to be 100% covered. Even if we go to the politics, which I'm going to talk about in a minute, which is the healthcare for all plan or lack thereof. So now you're spending more money at the doctor's office. Yeah. You're spending more money at the treatments. You're spending more money when you go pick up your prescriptions. And if you think you have an insurance plan that's covering all those costs, think again. And if you have a plan that's covering those costs, how much are you paying every month for that plan that's covering those part of those costs? Now, because you consumed the foods that were cheaper on your budget 10 years ago, now 10 years later, you are spending more money on your health care. In addition to, now you're trying to eat a little better because they're saying, okay, now you're in trouble. You were in trouble before, but you didn't have the signs. Now you're consuming foods that are better, but you're also taking medications. So your expenses probably tripled from what you thought you were saving by buying the hot dogs or buying the bag French fries or the fast food restaurant visits, or not buying things out of the produce section because you believe they're going to go bad, because you know that you're not going to eat that much of it when you get it home. Those things. So that's the second. And the third is the politics of believing this message that we're getting, that there's this health system that's designed for us to have health care. Understanding that health care is treatment and procedures for things that are preventable for the most part. The majority of the things that we're spending all the money in the healthcare costs for are things that are preventable. Now let's think about what money we're spending on that. That's a massive amount of money. That's a massive amount of money. And for the majority of people that I'm speaking to, you are paying that bill. Because the 1%, they're not paying that healthcare for all. That money for healthcare, whether it's Medicare or one insurance or multiple, it's coming out of the people below the 1% group. It's coming out of your budget somewhere. Maybe it's hidden. You don't see it. But that's important to understand, that your cost is going up while you're believing that you're saving money right now. You're believing that if you buy something in the store that's inexpensive and you eat that and you feel full and you feel fine, you don't feel sick, you're believing that you're winning. But you're not, because the price that you're paying for saving that cost is far higher on the other side. On the other side, you're paying extra for all this health care, and you need treatment for things that were preventable. When you're being treated for diabetes, when you're being treated for high cholesterol, when you're being treated for high blood pressure, and all those things that are preventable, type 2 diabetes, the things that are preventable, when you're being treated for those things at a cost to you and yes, everybody else, because everybody that pays into those plans, that's where the money comes from to pay for those costs. Everybody that pays into those plans, that's where the money comes to pay for those costs, for those preventable procedures and treatments. Not to mention that it takes a toll on how you age. And everybody wants to be happy and healthy as they age. Nobody wants to be aging where it's no fun for you and it's no fun for the people who love and care for you. If we could just focus right now on where you are, on making the connection between your finances and your food and your health, right now you could save a lot down the road. Is it really worth it? We can't ask you if it's worth it after it's too late. We can say, was it worth it? Yeah. But now you're here, you're there, and you say, was it worth it? Was it worth it for fast food chicken and sweets? Now that you're here, I'm pretty sure most would say no. So right now, if you say, is it worth it for me to have struggles and hard times and strokes and taking insulin every day and preparing my own insulin until I can't see any longer, and then I have somebody else preparing it, and then dying at an early age because you couldn't control the blood sugar, or you couldn't find a transplant for dialysis in time. All of those things that hit you that are preventable because of the things you consumed early on that you thought were cost effective for you in the short term, that are actually not in the long term. That's the message I would really like for people to take home, is the connection between your finances, the connection between your finances and your health. Your health determines how much you're going to have to spend down the road. So what your financial status will be. And you don't want to get to the point where you're spending all of your money on healthcare and there's nothing left. So you didn't have a chance to thrive at all. You just got into that survival mode and you just stayed there. Your health is determined mostly by the foods you consume. Healthy people come from eating healthy food. And you can save yourself a lot of heartache and a lot of money and a lot of expenses if you know in the beginning, spending that money on healthy food in the beginning is not a loss. It's an investment in your health. Just like people make investment in money so they can have retirement accounts later on down the road, they start making those investments early on. They tell you the sooner you start, the better. It's the same thing. Start making the investments in your health early on. The sooner you start, the better. The best time to start focusing on your health, if you're 20-something or older, is 20 years ago. The second best time to start focusing on your health and the foods you consume that affect your health is today. It's true. Whether you're talking about money or your health, the same thing. Start now. What you do now affects how you feel, how you look, how healthy you are, and how happy you are. Because generally people that are unhealthy and struggling and living day to day, fighting that fight, are not happy. And your emotional health affects your physical health. So if you're fighting off something that was preventable, by the way, if you're fighting off something, that's stressful. And that stress only compounds the medical problem or the condition that you're fighting. Every way you look at it, no matter how you look at it. I know my message is the same all the time, but every way you look at it, no matter how you look at it, the food is going to determine how healthy you are for 90+% of us. We can focus more energy on all those things that are not preventable, that we don't have a clue about yet, if we didn't spend so much money and time on all of these preventable illnesses. We fall into the trap of eating all these products that are marketed to us that are not healthy. And then we're in another trap where we're stretched with our budget trying to cover the cost of treatments and procedures that we didn't even need if we had consumed healthy food early on. Start today. Healthy food today. Buy something healthy today. Consume something in its natural state, just the way Mother Nature made it today. Don't put it on the stove. Don't buy it and open it, peel a package open to get to it, move the paper back. Something that you just picked up and you know it came off a tree, just that way. And get into the habit of consuming those things every day. I'm not pushing plant-based on you. I am plant-based, but I'm not pushing it on you. Do whatever you like as far as those choices. There are so many. But try to find healthy food, whatever category you're in. Try to find healthy. That means it's not packed with sugar. It's especially not packed with sugar. Even if it has some salt, it's not as bad as when it's packed with sugar. But you want to cut back on the sugar and you want to cut back on the salt. And it'd be great if you could get a little activity in on the side too. I hope everybody got something from my message today. I'm just trying to share healthy living with people. It's holistic. It's about your mind, body, your spirit, your soul, all of that wound together. But they're all affected by the foods that we consume. Hey to all the baby boomers out there. Hey to all the other generations out there that are listening. I love all of you. I wish everybody the best. And until next time, everybody have a wonderful day. Bye.